This is Sally. After acquiring chronic kidney disease at 63, Sally has been performing peritoneal dialysis for the last 2.5 years. Sally is preparing for her nightly session of peritoneal dialysis. Per usual, Sally turns on the dialysis cycler, hangs the dialysis and drainage bags, and connects the catheter to the lumen in her abdomen. Dialysis is the removal of waste products that the kidney would usually filter from the blood using a dialyzer. Peritoneal dialysis, or PD, is an at-home method that uses the patient's own peritoneum. This alternative to hemodialysis, or HD, frees patients from multi-weekly dialysis center visits, while also providing gentle, daily body filtration. Over 26,500 patients in the US alone use PD. However, there is a high risk of infection at the opening of the PD catheter site. Infection of the peritoneum, known as peritonitis, can eventually cause scarring of the peritoneum if the infection is not quickly treated. When severe, peritoneal scarring will prevent the peritoneum from acting as an efficient exchange barrier, making PD impossible and limiting the patient to HD. PD can last up to 10 years, but due to infection, patients switch to HD only after 2 or 3 years. Currently, the main preventative measure is patient sanitation. Once there's an infection, it may take 1 week for visual cues of infection to occur, including flu-like symptoms or discoloration of the distillate. The patient then sends in a sample to their physician to perform a culture, which could take another week. This lengthy process contributes to the scarring of the peritoneum. We are Team JAMM, and we want to design a way to detect preclinical peritonitis for patients who are using PD in order to treat the infection earlier and prevent scarring of the peritoneum so that PD can continue to be utilized.